Good afternoon. This is the 19th day of August 2013 and you're on the news desk where news is brought to you as it happens. A little later we'll be joined by the Secretary to the Judiciary, that is the Registrar of the Judiciary, Gladys Sholei, on her take regarding the, as you might have known right now, she has been sent on compulsory leave pending investigations into a procurement deal involving 5 billion shillings. We have those details also. Joining me will be Pascal Munyoro talking about devolution of health. You're on the news desk. Welcome to the program. The Judiciary Service Commission is set to meet this afternoon over the fate of Chief Registrar of the Judiciary, Gladys Sholei. At a meeting in Mombasa last week, JSC had resolved to send Ms. Sholei on compulsory leave of a financial impropriety in procurement procedures. Rita Tinina is at the Supreme Court and will be joining us with the very latest regarding that particular matter. Right, we'll be getting back to that particular story as and when it develops, but students pursuing tertiary education in medical sciences are now set to benefit from a new fund to be soon launched by the government. The fund scheme, dubbed Afya Elimu, is a partnership with the USAID Ministry of Health, National Treasury and the Vision 2030 and is geared towards responding to existing gaps in capacity development in Kenya's health workforce. Now, the fund will be administered by HELB as an affordable loan product and will have a management oversight committee of key stakeholders. A revolving fund will also be created to make it sustainable in the long term.
We are putting together a huge kitty to train particularly the area of paramedics, people or staff, Kenyans who are going to support working in the hospitals, so that we can be able to deepen that skill, which we, from our own assessment, it looks like we are miscued on that area.
The Funzo Kenya project has partnerships with the private sector through the Kenya Healthcare Federation, that is represented here by Dr. Amit Thacker. But we work very closely with the government, the Ministry of Health, that has the demand of all the health workers in the country. We work with the Higher Education Loans Board because there is nobody better to administer this program in the country than the tested systems that we have with the Higher Education Loans Board. And then, of course, because of their involvement, we have the Education Ministry, we have the National Treasury, and we have Vision 2030, because we are all aiming to increase the numbers of health workers in the health service in this country, and especially those areas that are underserved.
Trans Nzoia Governor Patrick Haemba has appealed to the national government to reopen the National Cereals and Produce Board despite the crisis facing it. Speaking at Amuka Primary School in Kwanza, Trans Nzoia County, the governor said the move will help farmers from selling their produce through middlemen who exploit them by purchasing their commodities at lower prices. The NCPB closed its operations after the money allocated by the Ministry of Agriculture to pursue, or rather to purchase, the maize for this year was exhausted, in addition to the allegations of misappropriation of the money.
We are working very hard to ensure we have a value addition plant in Trans Nzoia here, so that most of the maize will put plants in place, ends up within the county to add value, and we send out finished products. That's one way. We want also to form cooperatives to see how these cooperatives can help in marketing. I believe that's achievable, and we're going to focus on it.
Next is a very positive story in Kisumu, where the Childhood Cancer Initiative, or if you like CCI, held a Childhood Happy Moment event at the Jaramogi Oginga Odinga Hospital in Kisumu as a part of the psychosocial support program for children cancer patients. The donation was in response to the center's appeal for learning materials for children at the hospital. The highlight of the event was the distribution of gifts to children by Samaritan Pass Kenya, social support for children undergoing treatment in hospitals Medical Childhood Cancer Initiative started the program at the Kenyatta National Hospital here in Nairobi in wards 3A, B and C. According to the Childhood Cancer Initiative coordinator Joseph Omach, the moral and psychosocial support goes a long way in ensuring the kids who are cancer patients are comfortable despite their medical condition.
This is part, of our organization's psychosocial program, whereby we go out to encourage, strengthen, and express love to children who have been hospitalized for long periods.
Now, it has been termed as Dog's Paradise, but actually it is a safe haven for pets. A facility on the outskirts of Nairobi has become a home away from home for pets whose owners are for one reason or another away from home. Angel Katusia has that report.
She is the latest guest here. And those already familiar with this environment can tell there is an additional guest. All clean and clearly, this is a strange environment for her. She just arrived from the UK this morning and will stay here for a week until the owner arrives in Kenya. This is Yoani Yapaville in Salama along Mombasa Road. It is literally an animal farm. Cows, horses, dogs and cats. We are, however, keen on the pet business here. Cats and dogs. Robin Stanley and his wife Anita Mills houses people's pets at a cost.
The female dog comes into season and they don't want it mated accidentally. Possibly their garden in Nairobi or wherever they live is not secure. So they send it here for the 3-week period whilst that dog is wanting to be mated. If the client is going on holiday, either out of the country or locally, then they will send their dog here for 1 week, 2 weeks, 3 weeks.
They have different clients with different needs.
Clients coming into the country from America, UK, quite often they'll send their pet ahead of them. So they've arranged everything on that side. They know the dog has gotten to the airport, it's got on the aeroplane. They've arranged everything on that side. They know the dog has gotten to the airport, it's got on the aeroplane. We now have a vehicle at the airport. We have a clearing agent at the airport that helps us with KRA and customs at the airport. He will clear it at the airport. Our vehicle is there. We collect the dog. We transport it here.
The couple offers boarding facilities for dogs, cats, horses, and they sometimes can accommodate a rare pet to suit their client's need. They tell us they have housed rabbits in the past. It was set up in 2010. Then, the facility had only 2 dog kennels and would house a maximum of 8 dogs. Now it has 20 dog kennels and 4 cat enclosures and currently houses over 40 dogs and several cats.
They will come here and they will come onto what is not their own turf, neutral territory. And every dog is now finding out that there are so many new smells, new things to do, people to meet, and they rush around, and there's very little fighting.
Anita is a veterinary doctor, and so if the pets need any medical care while here, there's no need to panic.
Basic charges are 550 for a dog, anything up to about 12 kilos, so a small dog is 550 shillings a day.
Yeah.
And just like boarding facility, this one too gets fully booked at times. For instance, it's August, but the facility already has more than half its capacity booked for December.
We revisit our top story where the Judiciary Service Commission is set to meet this afternoon over the fate of Chief Registrar of the Judiciary Gladys Sholei. At a meeting in Mombasa last week, JSC had resolved to send Ms. Sholei on compulsory leave of a financial impropriety in the procurement procedures. Rita Tinina is at the Supreme Court and now joins us live with the details of that developing story. Good afternoon, Rita. Right, of course, we're standing by waiting for when we can receive Rita Tinina, who is at the Supreme Court right now, to follow up that particular story. As you know by now, the JSC had opted to issue compulsory leave to the Chief Registrar, Ms. Gladys Sholei, over financial impropriety involving procurement procedures that are said to have cost 5 billion shillings. And I can see right there we have Rita.
Well, good afternoon, Bonnie.
Right, Rita, what do we know so far coming from this story that just broke up last week?
Well, just a few minutes ago, the Chief Registrar of the Judiciary had emerged just behind me. She spoke only for a few seconds. I guess it didn't even, her statement didn't last for 1 minute. She just emerged to say that all that is being said, she has only learned from the media. She has not received any official communication from the Judicial Service Commission. She says the Judicial Service Commission is set to meet this afternoon over the matters that she says. She is only reading or watching on TV, and so she says she refused to take any questions from journalists who are gathered here, but she says she will be addressing the media once she knows exactly what the Judicial Service Commission has against her. Remember, the Judicial Service Commission meeting in Mombasa on Saturday resolved to send her on forced leave. The Judicial Service Commission accusing her of being involved in impropriety in procurement of several buildings for use by the judiciary. One of the buildings reports have it that is Elgon Court in Upper Hill, where the Court of Appeal judges were set to move to. There is also Rahim Tula Towers, where administration staff of the judiciary were also set to start operating from. Remember, during that JSC meeting in Mombasa, Chief Justice Dr. Willie Mutunga was not there, but this afternoon he is set to chair a Judicial Service Commission meeting. That meeting should get underway here at the Supreme Court buildings around about 2:30 p.m. Officials here at the judiciary have promised us that after that meeting, the Chief Justice will be addressing the press and giving a comprehensive brief as to what exactly the allegations against the Chief Registrar of the Judiciary, Gladys Sholei, are, and if indeed the JSC will stick to its resolution to send her on compulsory leave. So for now, we are just awaiting for the Judicial Service Commission meeting to kick off here. We are told that our meeting will get underway shortly after 2:30 or thereabout. As I had mentioned earlier, Gladys Sholei emerged a short while ago, just spoke for less than a minute, saying that for now she has nothing much to say. She has not received any official communication, and she is just reading in the papers or watching on TV the allegations that the JSC has against her. Bonnie.
Right, many thanks, Rita, for that update. And we do know for now that coming from Rita Tinina, the Chief Registrar Sholei has not received any official communication from the JSC regarding her forced leave, or rather also regarding the allegations against that procurement procedure. And of course, KTN will be bringing you that story as it unfolds. And half-year results for the Standard Group are out, and buoyed by growth in revenues, the Standard Group is reporting 109% growth in profit before tax, posting 223 million shillings for the half-year ended June 31st. During the first 6 months, revenue grew by 31% to stand at 2.2 billion shillings, up from 1.7 billion registered last year. Now, this was largely driven by an improvement in the business value lines. The circulation business grew by 6% during the period, while the print and TV advertising grew by 35% and 92% respectively. The Standard Group has been implementing a transformation strategy with the management upbeat that the growth momentum will be carried into the second half, boosting its overall performance. Right, away from those financial numbers, let's talk about medicine and health and devolution, and we'll be discussing how to devolve health in the counties. And I'm now joined by Pascal Manyuru from MEDS. MEDS is a mission for essential drugs and supplies. Karibu sana, Pascal.
Asante sana.
Recently, you had a discussion with the 47 counties in regards to helping devolve health to the counties. What was that about?
Thank you, Bonnie. Our intention was to create awareness, right, by involving the various ministers for health at county level,
right,
to who may not be aware of what we do,
correct,
to come on board. And the idea here is that we do recognize the fact that there are many challenges facing the provision of healthcare services in this country, and more so as we go through the developed structure, they get more compounded. So
now your partnership with the counties, was it just about dissemination or redistribution of drugs or also services?
It covered the whole spectrum of things, but basically lying on 3 pillars. One is the supply chain of medicines and medical supplies in an efficient manner, reaching all the wananchi in the country.
Right.
The second one is actually capacity building, because you do realize that where we are at the moment, the counties have not actually developed systems and structures that are capable of informing and educating their people to be able to carry out these healthcare services that have to do with the handling of drugs and medical supplies.
Right.
So on one pillar is actually to ensure that the distribution, the procurement and distribution of medicines and medical supplies done efficiently, and secondly, to ensure that there's capacity building at county level, so that those who are involved in the healthcare provision have actually continuous progressive programs.
Pascal, when you talk about efficiency, how different is it from what we knew in the old system where everything was centralized?
What's happening now at the moment, Bonnie, is that for us at MEDS actually have been developed all along, meaning that there's no corner of this country that we have not been able to supply medicines and medical supplies.
Right.
What is happening now is that because of the new alignments with developed government, there are bound to be new rules and regulations set at county level by the various governors and ministers for health in those counties.
Right.
So we wanted to align ourselves in our thinking and share the fact that it's not just a supply chain, as it were. We take great effort in ensuring that the quality assurance systems that are put in place, because medicines being what they are not like basic items you buy in the supermarket. So we ensure that using our WHO qualified laboratory, we are able to ascertain the quality of the medicines that we sell to the counties.
Right. Pascal, in probably less than 20 seconds, in regard to cost, is there anything that is going to be different going forward in this new program?
Yes, we see that happening from different fronts. One is that we just signed a memorandum of understanding with our neighboring East African countries.
Right.
We intend to go into a pooled procurement system where we hope to benefit greatly from the economies of scale. This in itself should actually bring the cost down. We hope to also ensure that the capacity building initiatives that are going on in different parts of the country, spearheaded by MEDS, actually play an active role in educating the people who are involved in healthcare provision, and who in turn should benefit from this to ensure that the efficiency is enhanced.
All right. Pascal Munyuru from MEDS, talking about devolution and trying to pass this to the counties. Good luck with that.
Thank you.
Asante sana for coming to the news.